Operation Health. On Operation Health, we try to bring you the latest developments in medical technology, and today is no exception. What are medical holograms? What can they reveal to the patient about the state of their health? How do they help doctors during operations? All this coming up in today's episode. My name is Piotr Poraj-Witewski. Welcome to the program. Are we witnessing a giant leap for medicine? Can hologram technology, up until now merely the stuff of science fiction movies, revolutionize diagnosis and become part and parcel of the operating theatre? Specialists with experience in using medical holography say, of course. With the three-dimensional visualization in the HoloLens, we can be more precise, safer, get at what we need to, and successfully treat the patient. Headsets with visual enhancements, holograms of the composition of our bodies, superimposed in real time onto the body of the patient, the live transmission of images to a consilium of medical specialists on the other side of the world, this is already a reality in Poland. That which the rest of the world is still carefully considering is already in operation in our country and saving people's lives. And very importantly, the technology came into being thanks to the knowledge and passion of Polish scientists. We are true innovators in the field of holographic imaging. Currently, doctors are able to prepare for operations by arranging visual data from computed tomography and magnetic resonance imaging into a holographic image. Let's now meet the representatives of the Polish company, thanks to whom three-dimensional images of patients are now being used in operating theatres. Operation Health. I'd like to now warmly welcome to our studio Dr. Ligia Kornowska and Mateusz Kiereb. Welcome. There's a lot to be proud of here. You have created some incredible software for both medical holography and doctor-patient education. The amount of awards you've won. Our sincere congratulations on that. Thank you very much. This has really been a great honour for us and our team. We've all worked extremely hard to prove to doctors, cardiologists and others that augmented and mixed reality can be used in the operating theatre. The contribution of their knowledge has led to a series of awards, the most important of which for us were those received by Polish cardiologists. We are also deeply honoured by the awards received in Munich. 3 prizes, 1 in the Best Overall category. This has been an exceptional success for us, and we are extremely proud. There is also somebody else with us here. Eddie is with us here, and unfortunately Eddie is in trouble because he has had a stroke. Dr. Kornowska? Yes, this is an ideal example of how a HoloLens and holograms, together with the software, are used in educational products which can support not only medical students but also doctors and other healthcare specialists when teaching about basic anatomy and various medical conditions. It can also be used by healthcare companies to make patients aware of the characteristics of various conditions, what the inside of our body looks like and how it functions.
Również pacjentów, jak poszczególne choroby wyglądają, jak wyglądają wewnątrz naszego ciała, jak dokładnie ich mechanizm przebiega.
So today we can go to the doctor and they can pull up a hologram like this and explain, for example, how a stroke of the kind Eddie has had affects us. Let's show Eddie and take a look at how the hologram works. So I'll put on this headset, and with this headset, apart from the presence of this studio and the set, I can see Eddie, who reacts to my movements and to where I am looking at a given point in time. And as I move closer, the way in which the information is displayed changes completely. We can now see the heart, which is fully interactive. I am able to change the way in which the data I see is received, for example, by activating an animation. This animation, which we can see, this shows the condition which was mentioned a moment ago, atrial fibrillation. We can see the blood clot moving towards the brain. This sort of information is quite obvious to a doctor, but allows, for example, students or those starting out in learning about medicine to more easily see how a heart operates and familiarize themselves with various conditions. We can also see here how a healthy heart should look, and we can observe the operation of particular ventricles. This is important because it is a very detailed anatomical model. I can really look into the deep inner workings of the heart and see how it actually functions, how the muscles work.
Jestem w stanie zobaczyć w głąb pracy serca, jak ono rzeczywiście pracuje, jak pracują mięśnie.
Diagnosis. We know that the start of effective treatment is diagnosis. The more precise, the higher the chance of the treatment being successful. One of the most precise diagnostic tools is that of computed tomography. Computed tomography is a key tool, very widely used in three-dimensional diagnosis. The data from computed tomography is most often used in 3D constructions as well as holographic imaging more recently. Tomography is used in all area of diagnosis and by all specializations. It is a very fast and precise method of diagnosis and allows a huge amount of data to be gathered on the patient. And the crowning achievement of this diagnostic imaging technology is magnetic resonance imaging, which is a method without X-ray radiation. Magnetic resonance imaging is very widely used in diagnosing diseases of the central nervous system, but also in oncological diagnosis, so that's checking the stomach or pelvis, and in diagnosing patients with prostate cancer. It's also a great method for examining breasts. All available methods of radiological imaging have up to now been used both in pre-operation diagnosis as well as during the operation itself. All available methods of radiological imaging have up to now been used in both pre-operation diagnosis as well as during the operation itself. However, the operators had never been able to see the patient in 3 dimensions. Holography is the next step in illuminating anatomical relations for all those who make treatment decisions on this basis. The headset gives full access to the scope of diagnosing the patient in 3D. They can generate a reconstructed image in the operating theatre or consulting room. Access to 3D data is for the doctor performing an operation on the patient. They are able to view this augmented reality hologram in the operating theatre. Specialists emphasize that there is a good chance that 3D technology will soon be used in all medical procedures. Please tell us in how many health centres, in how many hospitals can we find your invention and who makes use of it? We work with a large network of hospitals, mainly with university hospitals in Krakow and Warsaw, in Gdańsk and Łódź and Rzeszów. The number of these operations has made us conscious of, there's been almost 30 of them, of how much we are able to achieve and how much we are yet to achieve. But what is important for us is that this technology doesn't only have to be used in cardiology. It has also been used recently in orthopedics, as well as in operations on the aorta, the abdominal aorta. Something which isn't typical for us, but is of course typical for surgeons. These types of things were totally out of the ordinary for us because we expected our technology to be mostly used in various other types of procedures, such as through the skin or through a catheter. It turned out, however, that surgeons who were initially extremely skeptical, they gladly make use of it. Not only gladly, but later use the technology in the course of their daily practice. Here in Warsaw, in the Hospital of the Infant Jesus, we had the first orthopedic surgical procedure, and new needs and new potential uses are being found. We believe that this represents the future of medicine. We are witnessing a watershed moment which is approaching, and we can participate in it. When the next generation of HoloLenses come out, it will be possible to superimpose holograms directly onto the patient in a very precise way. Yeah, it's incredible. When you consider that the doctor will know exactly which part should be anesthetized, or remove something. Or remove something, yes, exactly. So what else could you wish for? Here we have young professionals, we have vision, we have progress, we have modern medicine, and we have success, successful Poles. This is very encouraging. Our most sincere congratulations. We wait to see the future results of your work. Once again, Operation Health will want to invite you onto the program with each of your new innovations, because it is, of course, in the interests of both the patient and the doctor. Thank you. Thank you. Operation Health. The European Centre for Health in Otwock. It is at this hospital, in the Clinic for Pulmonary Circulation and Thromboembolic Disease, that medical holography technology is used on a daily basis. There were a lot of concerns at the start, mostly as regards the device itself, the headset, because we asked how this could be used in the sterile conditions of the hemodynamic work area. How could we perform a 2 or even 3 hour operation with the headset on? And above all, there were questions, doubts as to whether wearing the goggles during an operation might not distract us or even make carrying out the procedure correctly more difficult. So we had a few test runs without a patient in order to become familiar with the device, to see how we felt with the headset on, to see if the transparency of the goggles was good enough. It turns out they ensure something amazing. They allow us to see the hologram and at the same time to see what's going on in the area being operated on. So in the introductory phase of these dummy runs without a patient, we came to see that this was definitely not a device that would hinder or impede us. Rotate. The initial distrust is connected with the fact that physically it looks like a lot of solutions other than the HoloLens. Everyone has had some kind of experience with virtual reality to a greater or lesser degree, and we often think of it as being artificial, of cutting us off from the reality which surrounds us. Mixed reality is a barrier which has been broken through. You just have to try it to see that it is a breakthrough technology. I'm a radiologist, and I don't hide the fact that three-dimensional reconstruction is not a technology which gets me overly excited because I use it every day. However, the way the hologram is displayed made a huge impression even on me. I hadn't used it before. I've prepared some data from computed tomography. We can now see it in the Holo system. We need to get the optimum angle. Good. And then we set the angiograph at the same angle. And we leave it like that for the operation. The HoloLens technology came online 2 years ago and began to be used on the cardiology ward at the European Centre for Health in Otwock. After a period of testing, doctors decided to use it in practice. When I had the pleasure of performing, I think, the world's first pulmonary angioplasty surgical procedure which involved the use of the HoloLens, I was able to communicate with my colleagues, I could control the hologram, I could make different incisions, different projections, manipulate it on the appropriate plane, and at the same time, I had my hands free the whole time to operate the guide wire and catheters. In short, to actively carry out the surgical procedure. This clinic, among other things, specializes in the surgical treatment of thromboembolic disease. Thanks to the right knowledge and preparation, it is possible to treat many patients. This is also due to successful diagnoses before and during the operation. HoloLens technology is really used during the operation because preparation and planning for surgery itself and viewing during a surgical procedure on blood vessels and correlation with what we see on the screen showing the angiograph is incredibly important for the operator. The three-dimensionality of the pulmonary bed strongly encourages and supports availing oneself of the 3D technology. Doctors accordingly confirm that virtual navigation during lung surgery makes things a lot easier, even for very experienced doctors. Holographic technology, showing the vascular system in 3D, is extremely useful as regards the pulmonary vascular bed. I will risk the claim that there is no other 3D vascular bed in humans than pulmonary circulation. Lots of blood vessels, which emerge at different angles that crisscross over each other, require a 3D visualization to reflect the actual reality in which they exist. Next up on Operation Health, we'll hear Jan's story, one of Dr. Marcin Kurzyna's patients. Jan suffers from a particularly aggressive chronic pulmonary embolism. Thanks to the correct diagnosis and treatment, this patient has a good chance of a full recovery. Interview with a doctor. With us is a doctor of medical science, Dr. Łukasz Kownacki. Doctor, how important, how needed is this type of application, this type of software, and how does it make the work of a surgeon easier in the operating theatre? In the European Centre for Health, with a team led by Professor Marcin Kurzyna and in collaboration with the MedApp company, We were the first hospital in Poland to introduce the use of holograms into the operating theatre. So this involves where there are tumours, for example, deep in hard-to-reach places, which have been diagnosed with imaging technology. And we can kind of extract this. Yes, we have it in reach, we can take it into our hands. It's an interactive hologram controlled with gestures and voice commands. And in between surgery, we can summon this reconstruction as a kind of cheat reference sheet. In addition, it will be possible to superimpose the data onto the body of the patient during breaks in surgery. So, for example, the pathology characterized by changing tumours can be made visible via segmentation, i.e. separation out from the other structures and superimposed onto the patient or next to the patient so that those anatomical relations can be... So you could follow the spread of cancer, for example. Yes, as with every pathological change, because of the existence of technology for examining the whole body with magnetic resonance imaging, we are able to carry out an augmented oncological examination, and this data can also be displayed in the form of a hologram. So for all intents and purposes, we pretty much have the whole body of the patient, and as has been the case so far, we reconstruct at our workstations. But we can also go a step further. I always say we see 3D data on a flat monitor working in the standard way, and here we have the 3D data in the form of a three-dimensional hologram. What's more, we can view this data on a one-to-one scale. A history of illness. Mr. Jan Demianowicz has health problems which started to bother him 3 years ago. Initially, he had reduced performance and was quick to fatigue. The illness progressed. It got worse and worse, up to the point where I couldn't go halfway up a floor of stairs. The patient was taken to the Pulmonary Circulation and Thromboembolic Disease Clinic in Otwock. Our patient Jan suffers from what is called chronic pulmonary embolism, or to give it its more scientific name, thromboembolic pulmonary hypertension. This disease is relatively rare because it affects 1 or 2% of those who suffer from chronic pulmonary artery embolism. Chronic pulmonary artery embolism is a common illness. In Poland, around 14,000 people are hospitalized as a result of pulmonary embolism. Pulmonary embolism, in its most aggressive stage, is fatal in 40% of cases. Jan was lucky to have arrived at the clinic in Otwock. Today, he has had several successful pulmonary artery angioplasty surgical procedures, during which medical holography proved to be very useful. For an explanation of what is involved in an angioplasty procedure, we asked Professor Marcin Kuzina. The essence of treating chronic pulmonary embolism with a balloon method is to break the serous blood clot with the aid of special balloon catheters. Here you can see a balloon catheter with a diameter of 2.5 millimeters. It is filled with fluid under a pressure of 40 atmospheres, which is several times higher than the pressure in a car tyre. And a catheter like this, fed very precisely to a very small arterial branch of the pulmonary artery, breaks the clot and normal blood flow resumes. As you can imagine, such a procedure has to be carried out with extreme precision. If we are talking about different support systems, then all modifications which allow for a three-dimensional visualization of things, which are three-dimensional by their very nature, are absolutely invaluable.
Wizualizacje rzeczy, które de facto są trójwymiarowe, są niezmiernie pomocne.
This device gives us the ability to visualize a given blood vessel, which we want to treat using the angioplasty balloon method. And during the surgical procedure itself, it helps the operator to use the correct tools, catheters, etc., to home in on the clot and treat it. Jan, who is now in much better health, is living proof of the efficacy of such treatment. I feel better and better with each surgical procedure. I can now climb to the second or third floor without getting especially tired. I have more strength and desire to work now, even to do physical work. I know that after today's procedure, there will be another 2 or 3, and then that'll be it. Interview with a doctor. Medicine has reached an extremely advanced level because a doctor can look right into an artery. look inside the heart. Exactly. It can be displayed in parallel with standard 2D data. Holograms can actually be superimposed onto the body of the patient, and we are then able to look into this virtual reality and view the inside of the patient's body. We try to push medicine forward and carry out these procedures with the use of additional options, which can be more or less useful. We have actually noticed that these kinds of ad hoc 3D reconstructions allow for real-time viewing of the inside of the patient in 3D, which has not been possible in the past. We carried out such a procedure for the first time last year, and we continue to try to create these kinds of reconstructions. Operation Health. Though the world is dominated today by technological solutions created in Asia and the US, Polish scientists and IT specialists are still making exceptional contributions. The proof is that it was Poland in which software was created which allows the creation of three-dimensional holography, which is used now in operating theatres. The inspiration was video games, which the company initially specialised in, but the time has come for a different challenge. We wanted to change the way in which medicine works with 3D imaging technology. We were very much set on developing telemedicine and on the things on which we are now occupied with, i.e. entering the operating theatre with a solution which strongly challenges the way in which a doctor looks at image data. A company which gathers illustrious Polish IT technicians has begun a collaboration with the largest computers consortium in the world. It has used the HoloLens technology and created breakthrough medical software. The HoloLens is a set of augmented reality goggles, which look quite futuristic. They allow us to see the world, which we can see here, without goggles, with the addition of a superimposed computed tomography or magnetic resonance image. So we can see what we normally see as well as a 3D image as if it were suspended in the air. But of course, it's a hologram. The Polish company was the first in the world to make this project a reality. On the other side, we met technology enthusiasts, people who were very motivated to bring 3D technology and holographic visualizations into medical practice. And working together, we can say that today the technology is ready, or at least almost ready, to be used in daily medical practice. The biggest global concerns, only in recent weeks, and not months, have announced that they want to be part of this technology, to some degree. But they keep looking at it as something that will be possible, and yet we already have a medical device up and running. So we should be loud and proud here, because we are world leaders in this field. Although this type of holography would seem to be a dream for the future, as the creators have pointed out, this is just the beginning. At the moment, we are operating in the area of cardiology and radiology and orthopedics. I can well imagine that such solutions will end up being used in the majority, if not all, areas of surgical procedure. This is most definitely the future of medicine, but also a future which is happening now. Operation Health. We have Dr. Mateusz Pawełczuk with us in the studio with some interesting medical facts. Doctor, with the heart comes blood, and blood needs to be transported. Apparently, you have the latest information on blood transport. At the moment, blood is transported in ambulances, which are sometimes specially modified for this purpose. If further distances come into play, then of course this involves a fridge. But what do we do when we don't have access to an ambulance, where there are no roads to take us? Or the population is very scattered. Delivery can be very difficult. Drones can help out here. In Poland, there is a startup which supplies these solutions to Australia and helps the emergency services to supply blood so that it is available for all patients. And how many litres can be transported? These drones? Up to 15 litres. And 1 unit of blood which a person gets is around 300 millilitres. So there's that possibility. Of course, we don't have to send one drone, there can be more. And another Polish startup can provide assistance here, which creates software which permits the optimization of the ordering of this blood. So the whole process is on its way to being automated. A doctor with the morphology results can wait for the blood that is missing from stores that has been ordered. And it's Poles, ladies and gentlemen, that have created all of this. This was Operation Health. We'll see you again next week. Until then.